Hello and welcome back to the channel. Let's talk about something that's deeply important for our health, our families, our communities. We're going to talk about hepatitis. That word can sound intimidating. Maybe you've heard it before. Think of it this way. Our bodies have an important organ, the liver. The liver is like the master chef in our internal kitchen. It works tirelessly to filter out toxins. It helps digest our food. It stores energy. Hepatitis simply means the liver is inflamed, swollen, irritated. It's like a key ingredient in your kitchen that isn't working right, and it throws the whole meal off. That's why understanding hepatitis matters. It's not an abstract term. It affects real people. Now that we understand what hepatitis is in general, let's get to know the main types. Think of them as different members of a family, each with its own personality and way of behaving. Hepatitis, a hepatitis B, hepatitis C. They all affect the liver, but they are distinct viruses that spread in different ways and can impact our health differently. It's like learning the difference between a mild chili and a fiery hot pepper. You need to know what you're dealing with to prepare for it properly. Hepatitis A usually causes a short-term or acute illness. Most people who get hepatitis A recover completely without any long-term liver damage. Symptoms can include fatigue, nausea, stomach pain, jaundice when your skin and eyes turn yellow. Understanding how these viruses travel from one person to another is key to stopping them in their tracks. Each type of hepatitis has a different path of transmission. Let's start with hepatitis A. This virus is found in stool and blood, spreading through the fecal-oral route. It can be passed through contaminated food. It can be passed through contaminated water. This can happen if an infected person doesn't wash their hands and then prepares food. It can also spread through close personal contact. Hepatitis B spreads when blood from an infected person enters another person. It spreads through semen and other body fluids. It can pass from mother to baby at birth. It can spread by sharing needles, syringes, or other injection equipment. It can spread by sharing razors or toothbrushes. Hepatitis B is not spread through food, water, or casual contact like hugging. Hepatitis C spreads similarly, primarily through contact with infected blood. The most beautiful part of this story is that we have the power to protect ourselves and our families. Prevention is our strongest shield, and the steps are often simple and straightforward. For hepatitis A and B, we have an incredibly effective tool: vaccines. These vaccines are safe and highly recommended for both children and adults. The hepatitis B vaccine is usually given to newborns, providing lifelong protection. Good hand washing is a superstar when it comes to preventing hepatitis. A. Washing hands thoroughly after using the bathroom, changing diapers, before preparing food. When traveling, drink bottled water and be cautious about raw food. For hepatitis B and C, prevention focuses on avoiding infected blood contact. Never share needles or drug equipment. Use licensed facilities for tattoos and piercings. Getting tested is powerful prevention. A simple blood test is the only way to know your status for sure. Our health is not just an individual journey, it's deeply connected to community health. The way we care for one another and share information is fundamental to prevention. Community centers are places of nourishment for body and soul. Perfect places to share health knowledge respectfully and culturally sensitively. When we talk openly about hepatitis prevention, we break down stigma. This is especially important in communities disproportionately affected by health disparities, including American Indian communities. These communities view health holistically, connecting physical, spiritual, and communal well-being. Prevention efforts are most effective when led by the community and honor cultural values. This means having trusted elders share information at powwows and community feasts. It's about meeting people where they are with culturally resonant messages. Simple acts like proper hand washing during food preparation are community care and virus prevention. Mobile testing removes barriers and makes it easier for people to know their status. These are acts of solidarity saying your health matters and we're all responsible for community safety. We've traveled together through the world of hepatitis, from understanding what it is to learning the practical steps we can take to prevent it. I hope this conversation has left you feeling not fearful, but empowered. Your health is your story, and you are the most important author. The knowledge you now have about hepatitis A, B, and C is a powerful pen in your hand. It allows you to make informed choices every day that protect your liver, body, and future. It's the choice to wash hands, ask about vaccines, and get tested. This journey is not one you have to take alone. Reach out to your doctor or local clinic. Ask questions about vaccination and testing. Remember the incredible progress, especially the cure for hepatitis C. Taking that first step is profound self-care and taking charge of your health story. Think about the ripple effect of your actions. When you share this information, you extend the circle of care and become a source of community strength. Protect your health, share what you've learned, and be an advocate for wellness. Thanks for watching. Like and subscribe to join our growing community of healthy humans. See you soon.